Saw a podcast recently of a more senior attending, more gray hairs than I have, who said that fear and doubt have zero place in medicine. And I think that's a pretty dangerous mentality to have, because I think both of those can be useful tools, especially if you're early in training. Doubt makes you think of other possibilities. Fear makes you concerned that you could harm a patient, which is always true no matter what you're doing. If it's central line, A-line, intubation, chest tube kind of patient, or if you're giving Tessalon pearls to someone at an urgent care. I've heard other people say a more healthy term for this is skepticism, right? Does this patient really need Tessalon pearls, or am I just trying to get them to shut up because they're here for a cough and it's not an emergency and I want them to leave? But they have little kids at home who might get into their medications, and you can get a wide complex tachydysrhythmia from their Tessalon pearls. The line between paternalism and the lack of fear and doubt, to me, is pretty slim. And it will be true that I will see a patient and say, this is acid reflux, this is bad GERD, there is nothing else this could be other than GERD. However, aortic dissection, however, pleural effusion, however, malignancy, however, necrotizing pancreatitis. The reason why we develop differentials is not only to flex a muscle of how much medicine we know, but to lower the likelihood of us missing something that can harm a patient. So I don't know if this guy is a surgeon, and maybe the mentality is different because you need to act with decisiveness in a way that I might not completely understand as an ER doc, which is fair. But I think it can be dangerous to say to an audience, especially because this was a podcast brought on by a medical student, to say you should have no doubt, fear, or misgivings in your mind at any point. That doesn't serve you. I think it does. Okay, time to go to work. Okay, bye.